And so SHAAP is the Scottish Health Action on Alcohol Problems. We're a partnership of Medical Royal Colleges and the Faculty of Public Health. We provide the authoritative voice on alcohol harms and potential ways to reduce them in Scotland. Today, we're going to be talking about alcohol harms that are caused for the LGBTQ+ community. And today, when we're talking about this community, we're talking about lesbian, gay, bisexual, trans, queer, questioning, non-binary, or otherwise gender or sexually diverse people. We do know that the harms caused to this community are greater than for others in the rest of society in Scotland. For instance, a recent health survey for England report found that 32% of lesbian, gay, and bisexual adults reported drinking over the 14 recommended maximum units of alcohol per week, compared to 24% of heterosexual adults. And a recent systematic review found that individuals who identify as lesbian, gay, or bisexual are 1.5 times more likely to experience alcohol dependence than heterosexual individuals. So if the LGBTQ+ community is more likely to experience harm caused by alcohol, how do alcohol treatment and support services respond? Well, that's exactly what we're going to find out today from our panel. I'm delighted to introduce you to our first speaker, Professor Carol Emslie, who headed up the research team behind today's report. Carol leads the Substance Use Research Group within the Research Centre for Health at Glasgow Caledonian University. Carol's research focuses on gender and consumption. I'd encourage you to please look up her Don't Pink My Drink work on Twitter and elsewhere. Carol leads the university's Crucible programme, which develops early careers researchers to communicate their research to the public, policymakers and practitioners. So without further ado, I'll hand over to you, Carol, and you've got 20 minutes exactly.
Thank you so much, Eleanor. I'm just going to share my slides, and then once the tech is done, I can relax. Are they showing up now? Brilliant. So I'm delighted to be here today. Thank you very much for the invitation. And as a researcher, it's absolutely imperative that we get our research evidence into action. And it's by working with the fantastic partners that we've got here today on the panel that hopefully we can get our research into action and affect change, which is what we all want to do. So this research has been very much a team effort. I particularly like to thank and acknowledge the work of Dr. Elena Dimova, who collected the data for this project and was the main researcher, as well as Dr. Rosaline O'Brien, Dr. Jamie Frankis, and Professor Laurie Elliott, and it's fantastic to have them here today too. So why focus on LGBTQ+ drinking? Well, as Eleanor's referred to already, we know that LGBTQ+ people are more likely to drink, they're more likely to drink excessively, and they're more likely to experience alcohol-related problems than heterosexual or cisgender people. So we know from the Health Survey England that around 1/3 of lesbian, gay and bisexual adults report drinking over the recommended limit of 14 units per week, compared to 24% of heterosexual adults, so quite a gap there. We know that alcohol dependence in this group is higher than in heterosexual people, and we know that heavy episodic or binge drinking amongst trans adults is also greater than in the general population. However, we've still got gaps in our knowledge, particularly around trans people's drinking, and also limited research about sexual minority women, so lesbians and bisexual women. There's a number of suggested explanations for some of these inequalities. Of course, coping with discrimination, with marginalisation and stigma is likely to have some impact on substance use, including drinking alcohol, and also on mental health. So this is a really important explanation to consider. Our previous research also with SHAAP highlighted the centrality of alcohol in the commercial gay scene and the fact that it was difficult for LGBTQ+ people to meet others in an environment that wasn't surrounded by alcohol. But what we're going to focus on today is the theory that there are additional barriers for LGBTQ+ people when seeking support from alcohol services, and that was the topic of our research study. So to find out about this, we conducted online interviews with 14 LGBT+ people who had used alcohol services in Scotland. And of course, this isn't a homogenous community. So we talked to 2 lesbians, 6 gay men, 3 bisexual people, and 3 who were heterosexual or heteroflexible over quite a broad age range of 19 to 65 years. And we had 11 cisgender and 3 trans respondents in the study. We also wanted to talk to service providers to get this perspective. So we talked to 15 service providers, including 9 clinicians, so that was consultant psychiatrists or specialist doctors at NHS addiction services, and 6 third sector service providers, either from alcohol support services or from LGBTQ+ services. We used thematic analysis to analyse our interview data, and the steering group, many again who are here today, helped us to interpret the data and formulate our recommendations. So thank you very much to our steering group on this study. So I'm going to take you through, first of all, the experiences of LGBTQ+ people who'd used alcohol services. Then I'll talk about the service providers' views and finally come to our recommendations. So LGBTQ+ people's experiences of alcohol services. So almost all of our respondents felt that there was some link between the LGBTQ+ identity and drinking. Many discussed the fear, shame and guilt associated with secrecy about their identity and how they felt that drinking had helped them to cope with this. So Liam says, it's just such a secret. You're constantly building walls to protect yourself from people knowing the truth, and the alcohol would take that away. I would get really drunk and try it on with some lassie. It was alcohol giving me the mask to pretend to fit in. And Faye said, I've had a strange relationship with my own sexuality and figuring out where I am. And most of that has been because of family backlash, which has influenced my drinking. So this link between family rejection, family backlash and drinking was strong within the sample. Respondents also talked about the need to overcome shame and stigma before they could contact services. So Ben says, services have got to be advertised in a way that isn't perceived to be shameful. I really did feel like I was proper scum, so really strong language here. To be honest, I felt like, wow, I can't believe my life has come to this. I'm having to go to this alcohol service. And Ash said, I told people false names when I was initially starting to get help. Later, I realised there was a lot of discretion in the services and I could let that go. And that was a big help to me because I started to really tell people who I was. And one strategy that a number of respondents in our study used was to try and get help from trusted services or trusted professionals. So one respondent talked about having a good relationship with his GP, so getting help there. Another gay man talked about waiting 4 months to be able to talk about alcohol at a sexual health service, because again, he had a good relationship with professionals there. And younger respondents talked about using university counselling services where they had already sought help for mental health problems. While many issues were shared across the LGBTQ+ community, there was an agreement across the sample that trans people were more stigmatised than other groups. And Daniel here says, it was very difficult juggling this dual life. I was back to hiding everything again. I spent 10 years with people not knowing about my gender identity, and I am in AA and even where I live. And Ash said, for me, alcoholism is a dis-ease. It means I'm not at ease within myself. That might be a lot to do with being transgender and not being comfortable within my own skin. Growing up, having to hide things away like that all the time, it was a lot of pressure. Gradually, it gives you mental problems. Every morning waking up and thinking, I can't be me. Years of drinking and hiding things, that's probably part of my condition. I've always been ashamed of who I am, that I was transgender or I was an alcoholic. Well, it's the stigma. And we can see how this cumulative effect of hiding identity has impacted on poor mental health and drinking. And indeed, almost everyone in the sample reported experiencing mental health problems, even though this was not something asked about by the interviewer, and this came up spontaneously. While some felt they had a good, there was good interactions between alcohol and addiction services and mental health services, this was not the experience of all respondents. So for example, Jake says, as soon as I go to my GP about my anxiety or my mental health, I'm either offered an antidepressant or I'm sent back to addiction services. Addiction services tell me that because I've previously been an addict, they'll not prescribe me anything, so advise me to go back to my GP. You almost feel like a tennis ball, batted back and forth from one to the other. And similarly, Mia said, mental health services don't want to deal with someone who's drinking, and addictions teams don't want to deal with mental health. And the two services don't seem to cross over or speak to one another or work in tandem. Another concern expressed by respondents was about interacting with other service users. So this was perhaps particularly acute when they were using residential facilities for alcohol treatments. So Naomi, for example, said, I didn't scream it that she was a lesbian from the rooftops, just kept myself to myself and got to know folk. But as time went on, I was asked, oh, have you got a boyfriend? I just had to say, no, I'm single, but I'm not into kind of guys. You're not going to feel comfortable just coming out with it. And it's not everyone that will accept you, because some people don't like LGBTQ+. And again, trans people had particular concerns about other service users, especially those who lived in smaller towns or more remote areas. So we asked respondents if alcohol service providers had asked them about their identity. Respondents reported, however, rarely, if ever, being asked about their sexual orientation or gender identity. And this sometimes led to awkwardness and frustration about when they needed to decide whether they had to raise it themselves. So Kai, for example, said, I don't think they prodded enough in that area, so it's just kind of brushed over. It's a bit bizarre in retrospect. That's a part of my life that needs addressing. It wasn't addressed. And Ben said, they didn't ask me about it. I told them, I said, I think this might be a big link as to why I was drinking, but they didn't actually ask very much about it. I felt like obviously they weren't really qualified to fully understand and probably didn't realise the extent of the link. So when respondents did disclose their sexual orientation, gay and bisexual men were positive about the response they received. However, sexual minority women were less positive about the response. So Mia said, it doesn't matter what service you're accessing, there's always a judgment. People say, oh, are you married? Yes. What does your husband do? You know, that kind of thing. And Eva, when she told the counsellor she was bisexual, I always felt like I was being judged every time I talked to her. She was quite distant. The minute I said that she was bisexual, she moved her chair back a wee bit. It made me feel uncomfortable, obviously. We also asked respondents what they felt would help. Mia took a broad approach. She said there's nowhere that's a safe place within the community that doesn't revolve around alcohol. So again, talking about the saturation of alcohol and the lack of alcohol-free spaces in LGBTQ+ communities. Harris referred to training. He said, I don't think lesbian, gay, bisexual need very much training. So I'm just suggesting there was understanding around these groups. I would have no qualms about identifying as a gay man in any circumstances to any medical provider. I think for the trans part, plus the gender fluidity, everyone should have a little bit of a refresher on how that works. And Eva talks about the importance of LGBTQ+ people feeling welcomed and signalling that services are LGBTQ+ inclusive. Just like even like a wee flag displayed somewhere, I think it would make people feel a lot more welcome because you'd feel less judged and you'd feel that these people probably have been trained. So the signalling that it's inclusive and the signalling that people are trained, both very important. So turning to service providers' views, we asked them if they do or they should ask about LGBTQ+ identity. Some did think this. For example, a couple of examples here. The literature around alcohol and substance misuse in an LGBTQ plus population is still a concern. And if you don't ask, you're missing a bit of the picture. They've got the right to not tell you, but I think you certainly have to ask the question. And another service provider. It would be useful to know, just to be able to get a better sense of what the scale of harmful hazardous drinking is among the LGBTQ plus population, for us to design our services appropriately. However, other service providers had different views. So one service provider said, we focus on alcohol. If their gender or their sexuality is causing problems for them, that's particularly important to know about. But I think there's probably nothing worse than feeling that someone's nosy and actually you're quite happy with where you are, you know. Another respondent said, if it was important for the person, it would be important for us. That's all we would want to know about. And finally, I don't think there's any difference in terms of patterns of use between LGBTQ plus people and heterosexual people. It's obviously troubling that there was this inaccurate information about patterns of drinking. So the concerns that service providers had about this was the worry that they would upset someone. Also, that they as service providers would get it wrong, use the wrong language, upset their clients. And a third respondent here says, you feel as their doctor, you should know about this. I think not having knowledge makes us feel a bit uncomfortable. When we dug into this a little bit further, some service providers did try and ask about this indirectly. So if they were doing history taking, for example, in an indirect way, some respondents said, I'll ask, are you living alone just now? And they'll say, I'm living with my partner. It soon becomes obvious what gender they're talking about. They might also ask, who's at home or are you in a relationship, to try and kind of elicit this information. It was very rare, however, that service providers talked about asking people directly about their identity. But here's one example here. I always ask if it's not clear whether or not the relationship is with the same sex or the opposite sex. And I always teach my trainees as well. This is something you need to ask directly because it might not occur to them that it's relevant. It's actually really important because it might be something that they're struggling with and is relevant to their mental health in general and or their drinking. We also asked service providers what they thought would help, and their answers were very much grouped around training and signalling inclusivity. So again, echoing some of our LGBTQ plus respondents, one service provider said, I think most service providers need a basic Trans 101, which enables them to not be frightened of dealing with trans people. So specific training here. Another service provider in the alcohol third sector said there was some discomfort from staff about asking about sexuality. We have been doing a lot of LGBTQ plus inclusivity work. So I think now we're going to move towards asking about sexual orientation on the referral form for counselling. So one service that's already taken some action here. And another service provider said, if I type anything LGBTQ plus into our search engine, it comes up with nothing. So as a queer person or a trans person with an alcohol problem coming to our website, what does that say to me? So why would I come through your door? So the idea that it doesn't matter how good your service is if you aren't demonstrating and showing that you're LGBTQ plus inclusive, people won't come. More broadly, service providers suggested that the broader culture was also important. So one said, you want a society and a culture and a government to be compassionate and open-minded about these things, which then trickles down into the way we practice, but nothing works like that, obviously. And again, we need more safe or more alcohol-free space for everybody. For most young LGBTQ plus people, their first connection with the community is either a pub or a club, because there's nowhere else for them to go to meet other people who are like them. So turning finally to our recommendations. So specific recommendations from alcohol services that follow from our research. Firstly, around monitoring. So importance here really of monitoring gender identity, trans status and sexual orientation to assess whether services are actually reaching LGBTQ plus people. And then once they've assessed that, considering how to improve services for this group. Training, really echoed by LGBTQ plus people and service providers, the importance of diversity training for all staff in alcohol services, and trans-specific training is seen as being particularly necessary. Inclusivity. Services, of course, should be safe spaces online and offline for LGBTQ plus people. Important to signal inclusivity and ensure that you're advertising via LGBTQ plus organisations and spaces and places where LGBTQ plus people will see adverts for services. It's not a homogenous population, so it's important to consider the separate needs within LGBTQ plus community, and also the importance of working towards the LGBT Charter. And of course, the importance of joined up services, these links between addiction services and mental health services to ensure people receive timeless and seamless care. And finally, when alcohol services are commissioned, organisations should be required to demonstrate that they have these appropriate policies, processes and training. We need future research on the needs of trans people and sexual and minority women. And more broadly, we need to prioritise alcohol-free spaces for LGBTQ plus people to de-normalise drinking and facilitate recovery. And of course, at a particularly broad societal level, more public understanding and acceptance of LGBTQ plus people is completely vital to improve health and to make it easier to access services. Thanks very much. Shall I pass over to David now?
Yeah, thank you very much, Carol. That was great. So we'll now move on to our next speaker, David Barbour. David is a community alcohol brief intervention practitioner at the Glasgow Council on Alcohol and is one of the founders of the Glasgow LGBTQI Substance Use Partnership. He played a leading role in beginning the work of this partnership. David's a gay man in recovery from addiction, in particular from alcohol. His work on the LGBTQI Substance Use Partnership is informed by his lived experience, as well as research by Glasgow Caledonian University and SHAAP, and also as well by Scottish Trans North Ayrshire ADP that he came across not long after starting work with the Glasgow Council on Alcohol. I'm now delighted to hand over to David, who is going to talk about how service providers can respond to today's research and will focus on the work done by the Glasgow LGBTQI Partnership. So over to you, David.
Thanks very much, and I'll try desperately to stick to my 10 minutes.
Thank you.
The presentation I'm going to give today, I'll start off with a very brief introduction of the Glasgow LGBTQI Substance Use Partnership. Bit of a mouthful. It's a partnership of LGBTQI, alcohol, drug and family support services, academics and the NHS Greater Glasgow and Clyde. And actually it was formed in 2019. And one of Carol's final recommendations there from the current report on joined up services was one of the reasons why we started the partnership, because when we started looking at this stuff, what became clear was that LGBT services and alcohol services didn't really talk to each other and didn't even really know each other. So not just joining up mental health with alcohol services, but joining up LGBT and alcohol services, so that we started to maybe at least we do meet now as a partnership once a quarter. If we do nothing else, we're at least talking to each other, but we do quite a lot else. What we aim to do is to address the substance use health inequalities in the LGBTQI community in Glasgow and beyond through two main strands. So we sort of look at service inclusivity and community engagement. So that's kind of more direct community engagement, community outreach, particularly looking at doing alcohol brief interventions in the LGBTQI community, which is the project that I work for at GCA. Why are we doing it and why is this important for service providers? Well, in the alcohol framework for Scotland, the Ministerial Forward, tackling poverty, inequality, providing good quality and accessible support on mental health is paramount to reducing recourse to alcohol and drugs. Now, obviously, mental health is much worse than in the rest of the population amongst the LGBTQI community for all of the reasons that we're aware of, shame, trauma, stigma, discrimination. So making sure that we have high quality alcohol services is crucial to addressing these wider inequalities. And in order to do that, we have to make sure that alcohol services understand the life experiences of LGBT people. And, it stands to reason most services are going to be majority staffed by and volunteers who are heterosexual or cisgender. So great when we have by chance or by design / chance LGBT staff working in these services, as GCA has numerous LGBT staff members, but we can't assume that the wider staff team will have the kind of insight that comes from being a member of the community yourself. So really important, as was said before, about training staff in order to do that. And one size doesn't fit all, so it would be great if you could just provide a service that was high quality for everyone and everyone was treated the same. But we really need to think about the fact that some communities, like the LGBTQI community, experience severe health inequalities around alcohol, and we need to think about both tailoring services for the community, but also that's not enough on its own, that we want to make sure that the entire service is acceptable and accessible to LGBT people, at whichever point they might access our service. So online, offline, in person, all projects being accessible and acceptable. Thinking about, in order to do that, we want to think about sort of hetero-cis sexism, which is not always active, and usually not active, especially not probably in healthcare settings where we're all trying to help people. But it might be stuff like just not representing LGBTQI people in our organisational spaces, physical, online, marketing spaces, making assumptions that all service users are heterosexual or cisgender, and using language that reflects that assumption unless we're told otherwise. I'm not going to go into this little graph in detail, but I'm sure you'll send the slides out, people can look over them. So there's just sort of different sort of layers of hetero-cis sexism, homo, bi, transphobia. What then would an LGBTQI inclusive substance use service look like is something we've given a lot of thought to, and we produced as a partnership a guide to this last year, which dovetails nicely with the recommendations in this report. So what we sort of see it looking like is that a majority of staff are trained and report a good awareness of LGBTQI life experiences and health inequalities. Staff feel confident or very confident in discussing LGBTQ experiences, sexual orientation or gender identity. LGBTQI people represented in outward-facing marketing or resources. Organisation visibly and clearly displays signs at multiple entry points that they're thinking about LGBTQI people. Staff don't assume sexual orientation or gender identity, or necessarily assume that LGBTQI identity is the only reason that we might be experiencing problems with alcohol and drugs. It may well be a reason, but it might not be. And also that one of the best things we can do probably to improve services is involve LGBTQI people in designing our services aimed at them, or just designing services overall. Good practice examples, Carol has mentioned a few, I'll not labour these, but yeah, some of the things that some of our partners have done is pride flags in offices, LGBTQI content visibly displayed in public-facing areas, website pages, social media posts, particularly around LGBT awareness days or months, but not exclusively. We should be thinking about this all the time. And maybe putting preferred pronouns on email signatures, normalising talking about gender. Longer term training, organisation undertaking award schemes like the LGBT Charter that LGBT Youth Scotland run. Review organisational resources and physical online environments so that LGBT people are represented. Consult with LGBTQI people in service design and actively involve them in it as well. So all of that really important stuff to do. And in terms of if you want to find out more about the work of the partnership and have more ideas, the guidance document is available on the Kinder, Stronger, Better website, which is the partnership website, co-produced by LGBTQI people in Glasgow and beyond. The LGBT Youth Scotland Award Charter Award is one scheme. There may be others. Stonewall, I'm sure, run schemes, but going through some sort of inclusivity scheme would be wise for any alcohol service. Follow the partnership on Twitter or Facebook, because we post regularly about research and good practice. And sign up to the Kinder, Stronger, Better newsletter, which is a quarterly newsletter where we publish all things to do with the community and alcohol and drugs. And the community champions that we recruited last year as part of our project from the community are heavily involved in producing content for that as well. So I'm going to leave it there in case I run over time. Thanks.
Thank you very much, David. I'm sorry that I've terrified all speakers into going over their time limits, but you were very good there. Thank you. And so now we're going to move on to our final speaker before the Q&A. I'm delighted to introduce you to Oceana Maund. Oceana is a community engagement officer at Scottish Trans. They are non-binary and use gender-neutral pronouns, they, them. Oceana has been in recovery for 15 years and is passionate about improving access to healthcare for trans people across NHS services. They're the co-author of reports investigating access to drug and alcohol services and also to sexual health services. And I'm actually very grateful to Oceana for being willing to share their experiences of accessing services to support them when dealing with their alcohol problem. So Oceana, over to you, and you've got 10 minutes. Thank you.
I will do my level best to keep into my 10-minute slot. So thank you very much. So first of all, I'd like to thank SHAAP for setting up this event and for inviting me to talk to you all today, and thank Carol and her team for this really important piece of work. I think it's only fair to introduce myself as probably Service User Plus. I have been in recovery for 15 years, which sometimes I've done that well, sometimes I've done that badly, but I think I have a pretty standard recovery journey, so to speak. I'm obviously trying to feed back on some of the points that have been made by Carol and David. You'll notice that I don't have a PowerPoint to show you. So basically, I wanted to focus on a few things. The first one is, whilst I welcome all the recommendations in this report and fully support them, I think my overriding feeling is one of frustration. When I first, I mean, before I start actually talking about what I think services should be doing and need to be doing, I think it would be important to qualify. As far as I'm concerned, alcohol services saved my life, and they probably saved my life on more than one occasion. So anything I have to say about alcohol services, I want a big caveat that I think you do fantastic work and it is essential for so many people. I was brought in to alcohol services by a person, by a fantastic single counsellor, effectively. I would never have approached alcohol services off my own bat. I managed to get myself into a situation where I had to be referred by my GP. I didn't want to be referred. I was not confident about going to services. I was absolutely terrified based on the fact that I was a trans person and there was no evidence anywhere that people were going to be able to understand who I was. This is back in 2007, by the way, so this is a long time ago when I first approached services. So I was referred by my GP and I met an alcohol counsellor in North Ayrshire. I don't want to embarrass them by mentioning their name, but this individual changed my life. And it wasn't necessarily that this individual knew anything about trans people, because they really didn't when I first met them. But that meeting was at my house. That meeting was in my home. And over the course of the first 3 or 4 meetings with this person, and after I had explained what a trans person was and why I thought that was impacting me, effectively this person became a buffer between me and services. So from that point onwards, whether whoever I was dealing with would effectively go through a vetting process by this individual, which protected me from questions from other professionals about what is a trans person, what is, what is your relationship with, no, it just alleviated the necessity for me to have that discussion with every single person I saw, which definitely eased my passage through services. That passage was not an easy one. And as I say, I have been in recovery since 2007. I've currently been absolutely clear for 4 years. But over the course of that 15 years, I've had to use services on at least 3 occasions. And each of those occasions has been starting with either a home or residential detox, and then followed by supposedly support options afterwards. And this is where it gets complicated, or this is where it has always got complicated for me. I have never had an issue in residential services with other service users. All of my issues are with service professionals, and most of the problems I've had with professionals are based on the stuff that was in the report that Scottish Trans did in 2016, and again repeated in the report that we're just looking at now. So one of my huge frustrations about the recommendations is the repeating, to start off with, but more so, it's about some of these issues are so easy to resolve. In my humble opinion, alcohol services are full of really compassionate and committed people whose sole aim is to make people better. And they know how to do that. They know how to talk about issues regarding stigma, regarding isolation, regarding all of these kinds of things. They're very good at doing that because they do that for other people. The issue comes when, and I'm speaking specifically on trans here. Obviously, I am a trans person. I access this service as a trans person, and I work for a trans organization. And obviously, the report that we did when we were looking at this was specifically about trans people. So I'm talking about the trans experience. The gap between the skills you have and the skills you need to be able to deal with trans people is nowhere near as big, I think, as people think it might be. Some of the service provider feedback from this report says a lot about services being uneasy dealing with trans people because you don't want to upset us. Thank you. That's great. Unfortunately, the problem is, because you don't want to upset us, that means you don't talk to us. It puts an immediate barrier between you and us, in so much as you're scared of getting it wrong. And people who are scared of getting it wrong tend to just not enter into that conversation at all in the first place. So on one level, what you actually need to know to give you the confidence to deal with trans people is very simple. You need to know basically what our lives are like in a wider societal sense. So where we are at, for example, where we're at with healthcare in general, okay, will be a good start. So you would need to be aware that at the moment, for lots of trans people, we're stuck in a limbo when we're waiting for support services for being trans people. When we're waiting, one of my worst periods was when I was in a waiting list for a gender identity clinic. My drinking went completely out of control. And most of that was down to the fact that I was a trans person desperately trying to find help, desperately trying to move forwards, and being left in limbo by services. This situation is actually worse now than it was in 2007, 2009. Trans people are currently in a system where we're waiting anything up to 4 years to get a first appointment with a service provider. Now, I did see in some of the service provider comments, there was a comment about, we don't know anything about trans people. Gender clinics know something about trans people. If they want to talk about gender, we should go to a gender clinic. That is not an option that's open to most trans people. And in my experience and how I experience services, I don't need you to know everything about what trans people are and what all the problems we solve. That was a single conversation from me with one professional, which took in total over a few meetings, maybe 2 hours, to talk about, okay, this is where I think a lot of my alcohol dependency problems have come from. I've been drinking since puberty, basically because I have been in a state since puberty, because I have been struggling with my identity. Not every trans person will feel the same way. When we did a survey when we did our work about this 5 years ago, we found that 50% of the trans people we spoke to had trans down as a factor for why they were drinking, but 37% did not. So, you know, this is absolutely not saying that taking a blanket approach that everything to do with trans people, everything to do with an alcohol dependency issue is because of your trans status, but it can be. And I think the point is, it just has to be open as a discussion topic. It's not a case that you have to know everything there is to know about trans people. As service providers, you could learn everything you need to know in an hour's awareness session, which will teach you about the right language to use so you're not upsetting anybody, and just some very basic background on where the trans population sits at the moment and some of the issues that they may or may not be experiencing. Certainly, if people are in a 4-year waiting list for treatment, that's obviously going to have an impact on their mental health and probably have an impact on the amount that they're drinking. When we come to actually talking about whether identity is relevant, whether a gender identity or sexual orientation is relevant to the treatment process, maybe it is, maybe it isn't. That's not the point. The point is, it can't be a closed subject. If, you know, lots of the issues, certainly for me, and I think many other trans people share this, until we get treatment and help and support, we completely repress what we are feeling. Sometimes because we don't understand it, sometimes because we've been made to feel shame about it, sometimes stigma and discrimination. What we don't want to do is get into another situation where that is a taboo subject, because that reinforces all of the negative connotations that we brought along. So it's not so much that you would have to be a professional or an expert in any way on gender identity. It's just that that cannot be a subject that people can't discuss, because that just reinforces the discrimination, the stigma, and the isolation that they're feeling in the first place. We talked about, both David and Carol have touched upon monitoring. You know, how do you make your services more attractive? How do you make your services more open to trans people? Yes, it's absolutely about explicit and visible signposting in your waiting areas, on your websites, on your any kind of your outward facing materials. So that's it, from pride flags, all of that kind of thing. But specifically on things like intake forms, one of the comments again from service providers was, I don't think there's any difference between LGBT and mainstream drinking habits. Now, we know that's wrong, but how do services establish that information? How can we find out that LGBTQ service users have a different pattern of drinking or behavior? We can only do that if you're monitoring who comes in through your doors. So this has
Christiana, I'm really sorry to have to cut you off there. Just finish your point, and then we'll move to Q&A.
Okay. So quickly then, my point on data and monitoring is it's not just about data and monitoring. It's really important because when a trans person tries to access your service, they can see on a form that you've asked for questions regarding a transgender identity, which gives them an indication that at least you have put some thought into it. But also at the back end, it means that when you're coming to assess how your services are doing and which people you've been talking to and which people you haven't managed to talk to, again, you can go back to your data and monitoring and look who's using your service, look how long they've stayed, look what they accessed, look what they didn't access. Right, I'll stop now. I could talk for a week. But
no, that's brilliant. No, thank you very much, Oceana. And I think what you have showed is actually, whilst to some professionals it may seem like dealing with or being open about sexuality and gender identity may be a challenge, it is often intrinsic to someone's alcohol problem, or certainly can be intrinsic to someone's alcohol problem, and is actually potentially quite simple to overcome as well in terms of knowledge and skills. So thank you. I think that made that really clear. We'll now move on to our Q&A. So in addition to our speakers, we're now also joined by Emma Roddick, MSP. Elected in last year's parliamentary elections, Emma is an SNP MSP for the Highlands and Islands region and is co-chair of the Scottish Parliament's LGBTI+ cross-party group. So Emma will be happy to respond to any points or questions today about what can be done by policymakers to address the issues raised in today's report and presentations. So I think we've got a couple of questions in. One of them is directed to you, Carol, which I'm just going to go back to, which was, it was from Oliver Wayne. Oliver, if you're still here, would you like to just ask your question?
Hi, yeah, absolutely. Sorry, just pressing buttons rapidly. Yeah, I just wanted to ask, like, this is a really great report, and it's really wonderful seeing some engagement with the trans community. But I kind of wanted to ask the authors, is there anything that you do differently next time?
Thanks, Oliver. That's a great question. It's always really good to reflect on these things. I think I wouldn't have started the fieldwork just before a global pandemic if I'd had the choice. We were kind of all set up to go out and talk to people, and then everything had to move online. And I think that really limited, particularly with the service providers. We managed to talk to lots of medics, but we didn't manage to talk to, for example, addiction nurses because they were so busy moving services around. And I think that would have been a really valuable perspective. I think we could always try harder next time to have more diversity within the LGBT+ community. We didn't speak to people who are non-binary, for example. And also our sample was often the majority white population. So again, that would have been good to have more diversity there. Thank you.
Thanks so much.
Thank you. Before I turn to a couple of the other questions that have been submitted via the chat, can I ask a question to Emma Roddick, seeing as you're here, which is, obviously we gave you an advance copy of the report, so you've had a chance to reflect on it. And I wonder if you can tell us if there are any actions that you and other members of the Scottish Parliament may be able to take to be able to address some of the issues highlighted in the report.
Yeah, absolutely. I think it's hard to give specific actions all on their own because the big problem is still societal, and that is there within politics as well. Looking at the report, they're drastic figures, and it's intrinsically linked clearly that LGBTQI people are more likely to experience alcohol harms, but that's not a genetic given. That is a societal outcome, and so we have to think more carefully about where these issues, and I think Oceana put this really well earlier, that even within services and within policymakers, we still have these attitudes that are really harmful. I mean, in 2022, I wish politics were far further ahead than it is. I wish I had more colleagues in the community, or at the very least colleagues who are understanding or willing to learn to understand the barriers that we face. But attitudes here do still range from, there is no issue with queer phobia in Scotland anymore to, well, I'm sorry you're sad, but you should be sad because you're committing sin every day. So yeah, I hope I have lodged a members' business motion on the report, and I hope that it achieves cross-party support, and I can then lead a debate on the matter, and we can maybe get moving on some real actions. But at the moment, I think we're still at the very basic level, and this is shown in these statistics that it's still the way that we're being treated throughout our lives that is causing problems.
Yeah. Can I thank you, Emma, for your support on this as well, and we do appreciate it. Now I'm going to turn to a quite specific question from Shona Anderson. Shona, if you're here, would you like to just speak to your question?
Yeah, I'm sorry for the big long ramble to give the context. I've recently started working in a different area and was really very keen to find out what's around to support LGBTQ plus people. And it was a real struggle to get that information, even from people that I would have thought would have that type of information to their fingertips. Now, I was at a yoga workshop and I came across someone who was able to give me lots of really useful information for local people. But I was wondering if there was anything like some kind of national database or a national resource that did give more local information for people that are perhaps coming new into an area, professionals and people that are part of the community.
David, perhaps that's one for you.
The best answer I can probably give is, again, our Kinder, Stronger, Better website. We do have a services page on there, which we update as regularly as we can. And because the partnership was started in Glasgow, it mainly focuses on Glasgow-based services, but there are some in other parts of Scotland as well listed. So we list by alcohol and drug services, we list LGBT services, we list sexual health services, and we specifically list where any alcohol or drug service provides a specific LGBT element to what they do. So, for example, Ad Action in Glasgow provide an online chemsex drop-in, and the Mungo Foundation did and hopefully will again provide soon an LGBT recovery group. So that was in the Glasgow South Recovery Hub. So these sort of things are all listed there. Beyond that, I'm not sure of any other resource. We've kind of tried to plug some of these gaps with this website, including the research index I've shared in the chat, where we now have a really quite exhaustive list of research on this topic that is all in one place. And we have views to maybe move this to being more of a national resource in the future at some point, so that all of Scotland is covered and not just Glasgow.
Thank you, David. And then Graham Morrison's got a question. So perhaps whilst you're here, you might know David. He's asked if anyone is aware of any literature on LGBTQ plus people's access to or experiences of residential rehabilitation. I don't know if you know anything specifically on that.
I'd actually answered Graham in the chat privately and just said, just directed him to a research index, because I can't off the top of my head think of one on residential rehab. There was recent research published in the US on LGB people's experiences of recovery, which said that LGB people, trans weren't included in this study, had worse outcomes in recovery from alcohol and drug problems because of historic mental health problems, pre-existing mental health, more likely to have a criminal record, and general just discrimination, etc. So that was concerning to read that even in recovery, we have worse outcomes. So even just getting there is the first step, but there's a long way to go after that.
Okay, thank you for that. Someone else, I'm not sure what their name is, but has asked David, but perhaps Oceana, you might be able to answer this as well, is whether there are any peer support recovery groups for LGBTQ plus people in Glasgow or anywhere else in Scotland.
I'll very quickly come in. Oceana, if you know of any more, feel free to come in after me. But there are two, as far as I'm aware, it might even be three now. I'll need to double check this. Alcoholics Anonymous LGBT meetings in Glasgow. And I'm sure there are some at Edinburgh as well. I don't know about elsewhere. and as I say, the Mungo Foundation did run a recovery group, which was started by Judith Schooling, a trans person who has since, I think, gone travelling. We're working as a partnership to try and support Mungo Foundation to get that back up and running. And I know some of our other partners are considering starting LGBT specific groups. Smart Recovery have been in touch with us about it. That's sort of stalled at the moment. But a lot of the time, it's probably these groups start because LGBT people start them. So if there isn't one and you think there should be, we might not always have capacity to be the ones that start it. But if you come to us and say you want to do it, we'll support you. So.
Okay. Yeah, well, that's a good offer. Thank you. Oceana, have you got any suggestions to add to that, or any other recovery groups that you may know of?
I'm afraid I haven't, but I would like to congratulate David on the sales pitch and agree 100% with what David said. Often it is a case of setting these groups up yourself if you think that something is missing, and yeah, look for support to do so. Yeah.
Okay. Yeah, thank you. I think we've got time very, very quickly for a comment or question from Alistair McGilchrist, the chair of SHAAP, if you're here, Alistair.
Thanks, Eleanor. I didn't really have a question. It's an opportunity to say thanks to all three speakers who I thought were fantastic, all delivered on their brief 100%. But I was interested in some common themes, I mean, which I really apply across the board. I mean, maybe the LGBTQ plus element kind of highlights the discrepancies in their system, but these discrepancies exist across the board. And the two which struck me were, one is the dual diagnosis, the mental illness and addiction. That comes up time and time again in terms of our services. It's something we've really got to address with services. And the second thing is hearing the comments about the lack of training and hearing what Oceana said about the sort of barriers to accessing service. I think, this is a personal bias actually, I suppose, but I think nearly all stigma arises from ignorance. It's always about lack of knowledge and lack of training. Once you have that knowledge and training and are comfortable, then the stigma falls, stigma levels fall. I don't deny the point about there being big societal changes still to take place, but in terms of provision of professional services, I think that training question looks to me to be easily addressed. So why don't we address it?
Yeah. Has anyone got any final reflections in response to that before I wrap up? Oceana.
Trans people aren't aliens. I think a lot of the fear is completely unwarranted, and really we are very forgiving as well. A little bit of training goes a very long way, and everybody working in alcohol services has the capacity to be better.
David.
Yeah, I was just going to answer Alistair's last point there. So the Scottish Drugs Forum, Glasgow Council on Alcohol, NHS-GGC, and the whole LGBT substance use partnership, so including you guys, will, I'm sure, have an input on this when we come nearer to the point of publishing it. Are currently working on an e-learning course on LGBTQI substance use health inequalities as part of a wider training pack specifically on that issue. So we hope that the e-learning course will be published later this year. It's now been funded fully, so and the training pack along with it. So just to let people know about that.
That's brilliant, thank you. And I think that makes the point nicely as well, that this this issue doesn't rest here. There's lots going on the ground, but we nationally will be working with policymakers and service providers to act on the recommendations of this report. It's really important that we actually make a difference with this. So I'd really also, if there's anybody in the audience who's not asked a question but would like to ask a question offline, please don't hesitate to get in touch with us afterwards. We're more than happy to hear from you. But I'd really like to thank everyone who's been involved in this report and in today's event, in particular Carol, David, Oceana and Emma, and I really do look forward to working with you, and SHAAP really does want to work with you to make a huge difference to take this research forward. So thank you very much, and we're looking forward to working with you further.
Thank you so much for cheering so effectively, Eleanor, and to other speakers, and for all the comments today. It's really much appreciated.